Hi, my name is Dustin. I'm a respiratory therapist and a respiratory coach. The question I've been asked is, my child is diagnosed with respiratory syncytial virus, and what do you do? And is there a way to find healing? Well, if your infant was diagnosed with RSV, which is respiratory syncytial virus, I want to start with this. You did not cause it. RSV, so I like to call it, is extremely common. Most babies will get it at some point. I'll walk you through it and how it affects their little lungs and help you feel confident in when this happens to your little one. So what is RSV? It is respiratory syncytial virus. It's a virus that affects the airways in the lungs, especially in small breathing tubes called bronchioles. Now I'll go over the anatomy of it. In infants, their airways are very small and narrow. Even a little swelling causes a big airway problem. This produces more mucus during infection. Their immune system is still developing. And what your body's doing is sending helper T cells to help fight the virus and absorb it with your macrophages. But when it gets a lot of mucus, it does decrease the airflow. This swelling in the bronchioles increases mucus production, makes it harder for the little lungs to breathe. And that's why it's hard for them to breathe. It's like breathing through a straw for those little babies. Why infants struggle more than adults? Adults can get a virus like this. It's called a cold. They just have a productive cough. They cough. They might have a fever, feel congested. But a child has similar symptoms, but their airway is much smaller and it can block their airway and makes it hard to breathe. That's why RSV can turn bronchiolitis for babies. Bronchiolitis is just basically inflammation in your bronchioles. Or a cold wouldn't cause that, but a child, it can lead to that kind of swelling. Now I'm going to go over the normal process of RSV. RSV usually follows this type of pattern. Days 1 through 3 of a runny nose, a mild cough, and a low-grade fever. So under 102. Then days 3 through 5, well, that's when it peaks. They'll have increased cough, that's productive, meaning a lot of mucus, and they're starting to breathe faster. This is usually the hardest time for us as parents or caretakers. Now, days 5 through 10 sort of gradually improves. So you got some relief here. Finally, my child is starting to sound different and look like they're happier. Mucus will start to thin out and the breathing will ease. Around the 2 to 3 weeks, the mild cough may linger. It's about a 2 to 3 week process. What is not normal is something that all of us will need to be aware of. If their breathing begins to get real rapid and their chest pulls in, called retractions, that's when the tissue between your ribs start to collapse. I call them retractions. It's like sucking in. That's showing that they're using their interstitial, which is the muscles in between their rib cages, to breathe. And that's not normal. They're going to use their diaphragm muscles, but if they start using those, it's a sign of distress. And then if you hear a grunting sound, which sounds like a that means their airway is getting narrow. And especially if they start breathing through their mouth, which is not normal for a child. Not normal for anybody. Their lips and face will start to turn blue. This is a decrease in perfusion in the skin, which is a sign of hypoxia, which is low oxygen in your peripheries. And they will definitely not eat. Okay, because having trouble breathing, the child will refuse breast milk or bottle feeding. And they'll appear sleepy and they'll have difficulty staying awake because they're very, very tired. They don't have a lot of cellular energy you get from oxygen. These are signs your baby needs medical care right away. Now, are there medications that you can give a child in this situation? Most of the situations don't require medications. It's mostly supportive. So what we do first is we provide them some oxygen to help them get some oxygen in their body. In rare cases, we give a nebulized treatment, like a steroid, and bronchodilators like albuterol to help open their little lungs. Most of the time, we provide fluids to help their body fight the immune system, because their body just needs to be flushed to get the nutrients it needs, because it's not eating food. The immune system is under distress. If it does get more and more challenging for them, we do provide steroids through an IV fluid to help systemically help the swelling. And then we might even include antibiotics as well in some cases, depending on what's the source. If it's viral, we don't usually do antibiotics, but sometimes viral infections can lead to bacterial infections because of the exposure of they're sick. And so now the normal flora in their body becomes an infection. So sometimes that does happen. And the goal is to really maintain the airway of the child. So sometimes what they'll do is they'll use cool aerosols to just help soothe the throat because of that bronchial inflammation. What can you do as parents? Keep the airways clear. Use saline drops, boop, 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 to help clean their little noses. It works very effective. I call them the little pinkies. You'll see them, the little pink little plastic things that have a little cap on them. Tiny little Kool-Aids. That's what it could be, pink little saline Kool-Aids. You can get these. They come pink or clear, and you just take them off and do a quick squirt. Hold them down because they're going to not like it. You go in each one, clear them out, and then just keep that sucker machine available as well. You can use the hand sucker or the suction powered one. The hand suckers have tendencies to get bacterial growth, so make sure you clean those with hot water. And you can do this between feeding, because a lot of times feeding stimulates an immune response and causes more secretions because the immune system's been already active. So if they eat, clean their nose out a little bit, let them calm down, and let them eat again. And they just do that off and on. Okay, if the suction isn't enough and it's too thick, you know you need saline. All saline is doing is basically helping the molecules separate into the hydrogen-oxygen molecule, and then all the other molecules, just helping it separate. Then hydration is very important. You get from the breast milk, and then providing humidity. Humidity is very important. Depends on the situation. I like to start with warm humidity because it really helps your lungs and help clearing the airway. But if you're starting to notice the child's having a sore throat, you can use cool mist humidifiers. That helps as well. Doesn't always help with secretions, but when the throat's inflamed, it does help. And then positioning of the child. If the position of the child is, if the child has thick secretions, it's good to keep them slightly elevated. Lying them flat makes it a little bit harder for those little airways to clear their airway. They're still learning how to cough and swallow properly. So it's good to help them with the using of their position to help them be able to move it easier. Now, what nutrients can we give these children? The best nutrients is breast milk. Breast milk has so many nutrients and values in it that helps provide for our child's immune system and overall growth. If you're going to give them anything, give them high quality breast milk. And at this age, nutrients is the most important thing they need right now. And you also can add supplemental D3 drops as well to help boost their immune system. Now, what's some toxins to avoid? Is always avoid smoking around the child and vaping. Vaping chemicals can get into a child's lungs just as well. So be aware of those, and please stop those as soon as you can or cut back dramatically. And if your child's sick, try to keep yourself clean as best as possible. Keep your clothes clean, clean your skin, clean your mouth. You have to help prevent those toxins getting into your little child's lungs. Be aware of strong cleaners, Lysol, bleach, Fabulosa. All those big name chemicals have sulfates and harmful perfume-like chemicals that can harm your body. If you have a family member who's actively sick, who actually has a fever, productive cough, okay, that's the person you want to keep them just temporarily, not directly contacting the little one. They can be around the little child, but don't directly connect the child up close for the time being. Because I'm a strong advocate for connection. You can so totally help support the family, just may not be direct contact. Make sense? Poor air quality can affect your child as well. Make sure the air is clean. Either require ventilation or improve the air filtering in the room. That will definitely help your baby. Because clean air is very important, humidity is important, and warmth. And remember, you did not cause this problem. It is very common. What you need to do is be confident in what to do. So, what we learned from this discussion is, first, it is common, and you have the tools now to combat it. Now, if this does happen to your child, first thing I would do is to get a little heated humidifier near their bedside. Next, provide some little saline drops, okay? You don't need the big sprayer, just little saline drops you can buy individually. Then you would get a sucker, either the hand one or the electric one. That's it. And then provide them quality nutrients through breast milk. Most of the time, the baby will be able to take care of themselves. You just got to be vigilant and take breaks. Rotate between the parents, because it's going to be very tiring. You're not going to sleep much. But your child's going to be greatly appreciated the dedication you gave to them and how much you gave your life and sacrifice for them. So while this is happening, it's very important to be closely monitor the situation. And if one of the caretakers gets tired, rotate. It's okay. So for example, if the mother is breastfeeding the child, you take a small little nap. Okay? And then after she breastfeeds, you take over. Rotate. You got to take care of yourself as caretakers and parents. Your baby's breathing does matter, and so does your peace of mind. You're not alone in this, and you're not behind. With attentive care and awareness, most babies come through RSV strong and healthy. It's a privilege helping you care for the smallest lungs. Thank you, and God bless.